Hello everyone, I am Dr. Aditya from the Shoulder and Knee Clinic. So we deal with a lot of sports injuries, and if you ask me what is the most common joint to get injured, actually it's neither the shoulder nor the knee, but it's the ankle. Ankle sprains are the most common sports injuries. In this video we will discuss how the ankle can get injured, what are the structures involved, how do we treat it, and what are the long-term scenarios. So if you see the ankle joint, the stability is given by the shape of the joint. There are ligaments around the ankle. On the inner aspect or the medial side there is the deltoid ligament, and on the outer side there is the anterior tibiofibular ligament and the calcaneofibular ligament. In addition to these ligaments in the bone, there are also muscles and tendons which give stability to your ankle, namely the peroneal tendons and the tibialis posterior tendons. During ankle sprains, how do they happen? So suppose somebody is running on an uneven surface, there is sudden twisting of the ankle where the body is moving in one direction and the ankle is planted. So typically that's the mechanism of injury. The most common injuries of the ankle are on the outer aspect or lateral ankle injuries known as lateral ankle sprains. So when we talk about ankle sprains, there are essentially low ankle sprains like a lateral ankle sprain or a high ankle sprain. So a high ankle sprain essentially affects the ligament between the tibia and fibula or the anteroinferior tibiofibular ligament. Now that sounds very big, but these are less common injuries compared to a low ankle sprain. The deltoid ligament, which is on the inner aspect of the ankle, is one of the strongest ligaments in the body and is less frequently injured compared to the outer ankle ligament, which is the anterior tibiofibular ligament. So when an individual has this injury, typically you will get symptoms like swelling around your ankle, difficulty in walking. Now what we need to understand is a majority of these injuries are low grade. So there is a grading of injuries of the ankle. So from grade 1 to grade 3. So grade 1 is just a stretch of the ligament, grade 2 is a partial tear of the ligament, and grade 3 is a complete tear of the ligament. What we need to understand is the ankle ligaments heal quite well in contrast to a knee ligament injury, but they may heal at a slightly elongated position which may predispose you to recurrent twisting of your ankle. Once you have had an injury, see how you are doing. If you are able to put weight on the leg, if you are not able to put weight on the leg, take rest, apply ice packs immediately, elevate it. Majority of the pain should come down in a couple of days. If your symptoms are not improving, then you should visit the nearest sports injury specialist. They may advise an MRI to assess the severity of the injury. Typically on an X-ray, you will not get any major changes. So based on the MRI, we can see whether there is a low ankle sprain or a high ankle sprain. As I said, majority of these ligaments will heal. So for a grade 1 or a grade 2 injury, it may take around 3 weeks, and for a grade 3 injury, it may take around 6 weeks to heal. Now healing doesn't mean that you return to your function after that. It is important that you complete the duration of the rehabilitation after the initial injury and immobilization, so as to ensure that you don't twist your ankle again or have a re-injury. So typically for a grade 1 or 2 injury, a special walker boot is used for the first 3 weeks where you don't put weight on the leg, and then after that you are allowed to put full weight on the leg. Whereas for a grade 3 injury, for 6 weeks weight bearing is not allowed. With good physical therapy, generally athletes are able to return to sports anywhere between 3 to 4 months. There is some sort of other injury in your ankle when you twisted your ankle. What do we do then? So there are certain scenarios where a surgery is indicated in an acute ankle injury. Suppose it's a high ankle sprain. So that means a high grade strain of the anteroinferior tibialofibular ligament, which can lead to abnormal joint kinematics of your ankle, or if there is an associated cartilage injury in the ankle. So these are the two scenarios which mandate initial surgery rather than a non-operative treatment. Lateral ankle sprains and lateral ligament injuries, generally surgery is required if you have had multiple episodes of twisting your ankle and it is stopping you from playing fully. With multiple episodes of twisting of the ankle, there may be a component of tendon inflammation on the outer aspect of your ankle known as peroneal tendinitis. So, injections can be given for tendinitis to see if your pain symptoms improve or not. If your pain symptoms are better, you're not having any symptoms of recurrent twisting of your ankle, again surgical treatment is not required. Surgery for ankle sprains is done arthroscopically assisted, where we repair the lateral ankle complex through a surgery known as a modified Bostrom's repair. So surgery as such has got very good results. Typically around 2 weeks after the surgery, you can put full weight on the ankle, and initially you are using a boot to walk, and typically by 6 weeks the boot is discontinued, and around 3 months you can resume sports. So even surgery has got very good results in case of recurrent instability of the ankle, and in long term individuals should not have any major issues. So this was an overall idea about ankle sprains. If you have any questions, you can write to us. If you liked our content, then you can share and subscribe to our channel. Thank you.